Developments are joined by Dr. Richard Schabas. Now, he's the former Chief Medical Officer of Ontario, and he's kindly agreed to speak to us from Toronto early on a Sunday morning. Dr. Schabas, thanks for your time. Really appreciate it. Over the last few days, medical officers of health have argued the government perhaps isn't being stringent enough when it comes to containing the virus. Let's talk about how you would rate the governments, and we have a federal government, of course, and provincial governments as well. But can I get you to talk about your assessment of government response?
You know, that's a huge question. I feel like governments, not just in Canada but around the world, are caught in this kind of high stakes poker game where they can't fold, and when somebody else raises the bid, they just have to match that. And I don't know where these measures are going to end, but in fact, I have a very different feeling on what is going on. I realize I'm a minority, a very small minority. I think we have fundamentally overreacted to this problem. I think we have fundamentally misjudged the magnitude of the problem. The reality is that in no country, including Italy, has the death toll so far come anywhere close to what we would expect from an average influenza year. And I think there's no particular reason to expect that to happen here in Canada. There have been stresses on hospitals in the areas that this disease is concentrated, because one of the key differences between COVID and influenza is that it is much more geographically concentrated for reasons we don't begin to understand. I mean, we could talk for an hour about all the things we don't really understand about this virus. So in fact, for a healthcare system to react to it, it's not so much a question of total capacity, it's a question of distribution of capacity. And that I think is going to be the challenge here in Canada as we get an outbreak. We talk about hundreds of cases. The reality is, if we've had 20 deaths in this country, or 19 deaths, because the case fatality rate is about between 1 in 300 and 1 in 500 in all probability, that means that 2 weeks ago we had 5,000 or 6,000 cases. We probably have more than that now. So it's out there. We're going to have to deal with it. I'm just not quite sure what we think we're going to accomplish through this flattening of the curve. Maybe we can do it. The evidence that these are lovely graphs circulating on the internet. They're beautiful to look at. They're very impressive. They're based on very weak evidence about what impact these measures will actually have. But even if they do have that impact, the virus isn't going anywhere. South Korea's finding that out now. So when does all this end? I mean, what's our strategy? What's our end game here? When do our kids get to go back to school? When do people get to go back to work? Because we're learning very quickly how unsustainable these measures are, and we've only been doing it for a few days.